everybody. My name is Lisa Farley, and I'm doing my presentation on my formal paper, The Effects of Healthcare Disparities, Noncompliance of Mammograms with the African American women population. The effects of healthcare disparities, noncompliance with mammograms among African American women. Mammogram screening is very important for all women when they reach 40 years of age or have a strong family history of breast cancer. The purpose of my formal paper is to investigate the reasons for noncompliance of mammograms in the African American women population. Understanding the benefits of healthy lifestyle choices and preventive measures can increase awareness as well as lower the mortality rate. Cultural factors and social support is one of my topics that I want to talk about today as far as the African American population. In the African American women population, religion has always played an integral part in African American people, and research indicates that social support affects the African American woman when they're seeking medical care and adherence to treatment. Most African Americans look to their social circle for answers, opposed to seeking a medical profession for the answers they need. And we need to, as clinicians, educate the African American population to ask questions and provide knowledge and reach out to this population, because a need exists to understand the complex issues related to mammography, knowledge, attitudes, and behaviors of young minority women. Socioeconomic and educational disparities. A lack of knowledge. According to KID, African American women lack knowledge about their own risk and consequently have lower rates of compliance due to this factor. In education, it hinders the African American female population from seeking treatment. This is in part due to living at or below the poverty level. And this hinders them as far as knowing the right questions to ask, or they have the lower levels of health literacy than a Caucasian female, and they're less likely to ask questions to the physician. In doing so, this limits the amount of information they receive, which is pertinent to their health, but they're not actually getting the actual information they need. Clinicians have a long way to go with regard to reaching out and educating and provide knowledge to the African American population. A delay in treatment. Research has found that African American women, they often delay treatment or they even terminate treatment early in their care. And this is in part due to barriers that we consider, they consider a barrier is childcare. They consider missing work. They consider missing, they don't have the proper transportation to get to and from these doctor visits. Therefore, they have a delay in treatment. And research found that African American women had longer intervals between an abnormal mammogram and diagnostic follow-up, 20 days compared to the Caucasian female who had intervals up to 14 days in their treatment plans. Financial is another issue in the African American population. Insurance or having the actual means to seek treatment and do the follow-up care is an issue. The sooner diagnosis is made and treatment regimens in place, the better the prognosis of this population. Risk factors. What young African American women need to know about breast cancer. First, they need to know that breast cancer in the African American population, 40% to 70% higher risk of stage 4 breast cancer when it is diagnosed. So education needs to be in this population to educate that the sooner you're tested and your yearly screenings are done, the better you'll have outcomes. Earlier you seek treatment, the better the prognosis. And research also found that genetics and family history are significant when it comes to patient knowledge in regard to genetic predispositions. Incidence and prevalence. Research indicated African American women compared to Hispanic, non-white, Asian, and American Indian population were more likely to be diagnosed at more advanced stages and less likely to receive recommended treatment. As in any case, with any clinician and patient, clear and precise communication must be in place for effective and positive outcomes to actually get the outcomes that the patient and the physician needs to come to an agreement for. Therefore, clinicians must understand the risk factors for lack of understanding among all women and work to increase clarity and relevance in information presentation and subsequently improve patient understanding. Insurance is a big barrier to healthcare, and with the insurance and the knowledge that they have, this helps a patient navigate the system and empowers them with information needed to make informed decisions about their own care if they had the means to help them take care of themselves. Aggressive breast cancer at younger ages is seen more and more in the African American women population. Survival rate of 78% versus a 98% survival rate among white women. And when Black African American women are diagnosed, their survival rate after being diagnosed is 5 years. And they have the highest death rates among breast cancer, and they tend to any other population. In conclusion, disparities in the healthcare system require more patient outreach, effective communication techniques, and inclusive patient-centered care.